Hello, hi, it's Dr. Erica. Thank you for joining me once again for another video concerning the heart failure series. This particular video is going to be about the progress or the stages of heart failure, um, and it's developed by the guidelines and officials, the American College of Cardiology, the American Heart Association, and so these guidelines are approved and they're official, and they are based upon the history and research of concerning heart failure symptoms, so forth. So I do want to go over this particular very important topic in the series, and it's the stages. So there's stages A, B, C, and D, four stages. And the first stage, as I go down the alphabet, then that means the more serious the stage. And these stages are non-reversible. So once a patient progresses to stage A, B, C, then D, then there's no cure, there's no reversibility. For example, use of exercise and dieting at that point is no longer relevant. The heart is at a point where it will continue to be prognosed as being more and more um, at a risk for heart attack and again mortality. So we want to make sure I want to make sure I go over the stages in this series. I think it's very important. And I'll give some examples as well. So stage A, the patient is at high risk and the patient is developing heart failure. Examples like hypertension, those patients who have chest pain, who might have vascular disease, um, metabolic disease, have gone through some sort of previous type of heart condition. They may also have diabetes. They might have clogged arteries as well, or atherosclerosis. So do be aware of stage A. And again, those are patients who have the disease. They're at high risk for developing the disease, I should say. They're at high risk for developing heart failure. And again, those patients already have an underlying condition, whether it be diabetes or metabolic syndrome or a hypertension or coronary artery disease or plaque along the walls of the arteries as well. So this particular patient is at high risk, and development of structural heart disease will put them at stage B. So if they have the risk that I mentioned for A and they're developing structural heart disease, then the patient has structural heart disease but no heart failure signs or symptoms. And that can be left ventricular overgrowth, also previous myocardial infarction, which we expect, and then a patient who has left ventricular systolic dysfunctioning, meaning the left ventricle is not contracting properly because there may be an underlying condition such as um, structural malfunctioning. The structure of the heart is changing in stage B, causing classification of official heart failure. Okay, but they don't have the sign of heart failure. They don't have the symptom of heart failure. It's just the structural on the EKG may show some changes. For example, there might be some changes on palpitation when palpating the heart, things like that. But there's no symptoms. The patient may not be experiencing dyspnea or shortness of breath or chest pain or weakness and fatigue. They might not be experiencing those, but their structure of the heart is changing to where it's going to eventually present where it can't contract properly and it can't relax properly. So this particular category is non-reversible again, and it's due to a structural change in the heart. Now, heart failure symptoms develop from B to C. So the patient does have, again, structural dysfunction, misfunctioning, structural changes are occurring, and then the patient, again, will start to feel the fatigue, the shortness of breath, chest pain, things like that. Okay. And then they are more intolerable to exercise. They're more intolerable to doing daily activity plus exercise. So again, when in stage C, we see the structural changes, we see the symptoms and signs of heart failure, and then the patient again has the underlying conditions of diabetes or a hypertension or coronary artery disease or clogging of the arteries along the wall. Okay. Treatment resistant symptoms are from stages C to D. That means that the refractory heart failure requiring intervention at that point. So there might be angioplasty that's needed. There may be a stent that is needed. There may be open heart surgery that is needed in stage D. This is very serious at this point in order to reduce the chances of symptoms and mortality. Okay, so stage D is going to be, again, that's when specialists are going to come in and have to do some sort of intervention, such as a surgery or angioplasty or open heart situation at that particular point. Um, Now, the symptoms are are still going to be there, but the actual examinations will see more detail as far as minute and micro changes, such as the changes in in calcium and sodium influx and all of those different ions and things that get the heart contracting. We'll see some changes there as well. So do be aware of that. And so this concludes this video of the heart failure. This is the stage one, or stage A, which is the first stage B, which is the second, stage C, which is the third, and stage D, which is the final stage. Okay, so we do have that particular video, and we have another video previously about the signs and symptoms of heart failure, or the classification of the signs and symptoms of heart failure. So do please visit that video as well. Thank you for joining me, and I hope to see you in the next video. Bye-bye.